Hi, my name is Shira, and I'm here to talk to you about acupuncture. I'm hoping that I will answer any questions you might have, maybe get you curious about other things, and kind of dispel some myths and misconceptions people might have about what to expect if they come for an acupuncture treatment. I'm hoping that this will also make you curious. If you have any questions, please post them in the comments and I'll respond to them. And hopefully this will start a discussion about acupuncture, which is my aim in doing this video. So what is acupuncture? Acupuncture is a branch of Chinese medicine. Chinese medicine is over 2,000 years old, and it has a rich and traditional history of healing, of therapy, and being a medicine for everyday life. As a branch of Chinese medicine, there are four branches in all. Acupuncture is one of them. You have herbal medicine, you have Qigong, which are exercises for health and things that I would teach a patient to do in between sessions and also after they finish seeing me. And diet. Food is seen as medicine in Chinese medicine, and diet plays a huge importance we place on diet. It also has a significant effect on our health. For many conditions, if we can change our diet or adapt our diet to suit those conditions, we actually need less medication. We actually need less therapy. A good example of this is type 2 diabetes. If we can control our diet and we moderate our blood sugar, then we need less medication or no medication. And in some cases, we can reverse or type 2 diabetes. This is, of course, in the early stages of the disease before we've started taking things like insulin or tablets. While we're still in that stage where a doctor will send us away maybe and say, try and get your diet under control and we'll see if you need a medication. This is a great opportunity to use food as medicine. How does acupuncture work? Acupuncture is an energy medicine. We are not putting chemicals into the body, rather we are manipulating the body through the use of the acupuncture points to stimulate its own healing mechanism. When we have a pain, that's a sign that the energy is not flowing the way it should. When the energy is flowing freely and there's no impingement to it, then we are healthy. We have no issues. When we have blockages to that energy, issues can develop. An example of that is if we have something has dropped on our foot. Yeah? We have swelling, we have a bruise, we have pain. So the energy is being stopped from flowing into the area because the swelling cuts the tissues off. We have a bruise because there's a clot that's also blocking the energy. So putting needles along that channel that's affected will move that energy, will clear the inflammation, will break down the clot and get the energy flowing again, that you have no pain. Another example we can use for that is think of a road, for example. Traffic is flowing smoothly. You have an accident, then the road backs up, causing more problems further down the line. Similar system. Our system is basically a transportation system for moving chemicals, hormones, blood, lymphatic fluids from one end to the other. When they're stopped or impinged, then we develop conditions, we develop pain, we develop something that isn't working. Do the needles hurt? My answer is no. Obviously, depending on where we put them in, you might feel them a little bit more. So if I'm putting them in around the finger because there's less flesh compared to the arm or to the bigger muscles, then yeah, you might feel a pinch, but it does not hurt. They're quite different from taking blood or having an injection where they are taking something out, so it's a much larger needle and it's hollow, or putting something in. Again, medication going in means that you need a larger needle creating a bigger hole. This is the size of our needles. So that's a needle. I don't know if you can see it there. It's very, very thin. The actual thicker part is my handle. We need a thicker handle to hold it. We have different sizes in needles. So that's a slightly longer one. This is a standard needle that I would use in treatment. Then we have longer ones. So this is an example of 3 different sizes of needles. They're all the same thickness, but the lengths are different. And the lengths are different because we are shaped differently on different parts of the body. So I would use this needle for points along the hands and the feet. This one, the middle one, I would use in the arm muscles, torso, and in the area between, in the calves. And then the longer ones I would use in the bigger muscles. So I would use this in the thighs or the bum. I could never use this needle, for example, in the hands because we just don't have enough flesh to support the needle. If I put it in, it'll fall out. Acupuncture points along the body. The points are on channels or meridians, and they are linked to organ systems. So we have the heart channel, which is linked to the cardiovascular system. We have the lung channel, which is linked to the respiratory system. There are over 365 acupuncture points in the body, and the various points have different functions. So, for example, some points along that channel will strengthen the cardiovascular system or will strengthen the respiratory system. If someone is coming into me with a full-blown cold and a lot of nasal discharge and phlegm and coughing, I will use a point to reduce the phlegm, to reduce the coughing. If, for example, you're coming in because you have a weakness in your respiratory system, you have asthma, for example, that is worse when you get a cold, then in between when you have a cold, I will be strengthening. I will be using points to strengthen your respiratory system so you are less likely to have an asthma attack when you get a cold. Do you put needles in private areas? So yes, there are points in private areas that are around the perineum in the groin. However, this is what is fantastic about our medicine is points are along a channel. And the channel just doesn't start and stop in a short area. They actually run throughout the body. So if, for example, with my male patients who come in for urinary problems or gynecological problems where it's affecting that area, then I don't actually need to go into that area. I will use the channel that's being affected, which will be discussed in the consultation. This is where all the questions come in. Where are you feeling the pain? What else is affected by the pain? It helps me to narrow down which channels are affected. And then I can needle distally. I can needle, for example, from the foot area, or maybe I might want to go from the chest area. Depending on what I want to do in that area, if I want to clear pain, then more than likely the points will be further down the line. I want to get it out and moving. So we don't actually need to go into private areas unless the issue is quite acute and it would benefit. And that's something that I discuss before we start. I don't just do that. How long do you need needles in? This is another common question that I get asked. It depends. For children under 10 years old, as a pediatric acupuncturist, I would only leave the needles in for a few seconds. They only need to be left in for a few seconds. Children change quite quickly, and any issues they might have haven't been going on as long as it might do for an adult. With an adult, the needles stay in anywhere from 20 minutes to 40 minutes, depending on what I'm treating. It also gives them a chance to relax, to do nothing. And this really kind of helps to lower stress and to give them a chance to just relax and stop all the thoughts that are going on and just give them a little break from everyday life. So it's a combination of just the treatment itself and also a way for people to switch off. How quickly should I see an acupuncturist? We want to see you when a problem occurs. So the more acute it is, the faster your treatment will work. If you come to see us, for example, if you have a backache and you wait till it's feeling better to come and see us, then it takes longer than if you'd come to see us as soon as you started feeling the backache. This is because, as with everything else, when things are in a state of flux and it's just happened, then it has to set in. Think of it like a tree. If you have a young tree and you wind it around a trellis, then while it's still young and it hasn't gotten solidified into that position, you can actually move it around. If you've left it for a week or you've left it for a month, then it becomes harder to move that tree around the trellis, to change its position. Leave it for years, forget it. Once you start moving it, then the branches will break. And we're just the same. This is why when we sit in positions for a long time, we get stuck in those positions where we develop pain. So one of the questions that I get asked a lot is, but I never had this pain before and I've been doing that. Yes, you haven't had the pain before because your body's been healing itself. But if you've been sitting in that position, hunched over a computer with a desk that doesn't suit you, not moving around, your body gets used to sitting in that position. So when you change it, when you stand up, it's a different position and then it's no longer able to make that adjustment as quick, especially if you've been sitting like that for years and years or months and months. How many treatments would I need? It depends on what you're coming for. If you're coming for something that has just happened, like a musculoskeletal injury, a headache, maybe you're recovering from childbirth, then you need less treatments because it's something new. If you're coming for something chronic or something that's systemic, so if you are coming to see me for fertility, your fertility starts from the time you go through puberty, even before. You wouldn't have known that maybe that you were having problems getting pregnant until you started trying. But that's years of things that are happening. So maybe your period's not being painless, having a good flow, something that's without a lot of clots and a lot of cramping. Those are all signs that your reproductive system actually needs a little tweaking. It means pain for us is a big sign that something is out of balance. I hope you enjoyed watching this little video, that I've managed to answer some questions, maybe clear up any misconceptions you might have had about acupuncture. If you have any further questions, please do drop me a line in the comments box, and I'd love to have your feedback on what you thought about the video as well. Thank you.